hope everyone's doing well. Inshallah, today I'm going to be presenting on cat-eye syndrome, or CES, in short abbreviation. Before I begin, I want to extend my gratitude to Dr. Ami Rakshasan for granting me this opportunity. And secondly, I know this is like 4 days in, but belated Eid Mubarak to everyone. So let's get straight into it. What is CES, or cat-eye syndrome? So CES is basically a rare genetic disorder caused by the presence of extra genetic material on chromosome number 22. You know, humans were born with 23 pairs of chromosomes. Everyone knows that, right? So each chromosome has a long and a short arm. The long arm is called the Q arm and the short arm is called the P arm. So basically, in the case of CES, the chromosome number 22, the Q arm has an extra copy, which is an abnormality. You know, if there is an abnormality in the DNA, there is an abnormality in the transcription, the translation, there's an abnormality in the production of proteins. So as a result, there's an abnormality in the baby, the fetus that's going to be developed. And that's the main point for the abnormality for the genetic disorder. And here's an image of an individual who's diagnosed with CES. You can see the similarity between the eye of the cat and to this individual who's diagnosed. So how is it how is cat-eye syndrome caused? Mainly, cat-eye syndrome is caused as a result of genetic mutations. Genetic mutations can be of 4 types. It can be direct heredity, it can be from your parents, your grandparents, it can be as a result of contracting viruses, or it can be a result of environmental factors such as UV radiation and etc. and so on and so forth. Or it can be as a result of the first reason we talked about, you know, the chromosome number 22. If there's an error in the DNA, there's going to be an error in the cell division. So it's also a reason what causes genetic mutations. So what is the prevalence, what is prognosis of the cat-eye syndrome? Cat-eye syndrome has an estimated prevalence of 1 in 50,000 to 1 in 150,000 live births. I've highlighted live births because most individuals who live past the infancy stage, they do not get to live long. So they mostly pass out after the 4th week. Males and females appear to be affected equally. So there's no difference in who is affected more. There's no lesser, there's no higher. Both the genders are affected equally. Patients diagnosed with cat-eye syndrome have iris glaucoma, which is a condition where tissues from the retina or pupil are missing. You know, in the eye, there's like several components. There's like the pupil, the iris, the retina, and so on and so forth. So when there's tissues from this part of the eye, like the pupil or the retina is missing, there is a structural deformity happening like this, if you can see this image. And that is what is iris glaucoma based on this slide. What are the symptoms? Now coming to the symptoms, you know, initially when you experience the symptoms, this disease may start to appear during pregnancy and as a newborn. During pregnancy, you can identify using like tests such as amniocentesis or ultrasound. You can identify because there's going to be deformities in the body, such as, you know, rib morphology and so on and so forth. Some of the common symptoms appearing are anal atresia, abnormal localization of kidneys, abnormal rib morphology, chorioretinal coloboma. These are just some of the few of the symptoms. As per my study, there's more than 30 symptoms for this disease. And because I could not list all of them, I just took the common ones as per the case reports and case studies published on well-renowned websites. The types of symptoms experienced and their intensity may vary among different people. So different people have different levels of experiencing these symptoms. Some may have higher, some may have lower. How is CES diagnosed? So as I mentioned, you know, during pregnancy, you can diagnose it using ultrasound tests. You can diagnose it using amniocentesis. There are also other ways such as karyotyping and FISH fluorescence in situ hybridization. It helps to isolate the DNA and locate it and identify it. And what are the treatment plans? So, like you have heard of any other genetic disorder, right? For CES, there's no cure. Genetic disorders are normally, you don't have cure. So, what can we do for this? We have to direct a specific treatment plan for the specific symptom. So there are many medications, there's surgery you can use to connect growth hormone therapy and occupational therapy and so on and so forth. Because you know, the symptoms like like I mentioned in the previous slide, the symptoms you experience are like such as, abnormal localization of kidneys, abnormal rib morphology, and things. This relate to the skeletal framework. In order to fix this, you cannot give medications and fix it. You have to do a direct surgery. So as a result, this is like a direct treatment plan for that specific symptom. And last but not the least, we have a case report conducted by 4 others. I don't know if you can read those names. This was published on PubMed in the year of 2014. To summarize this abstract, basically they have obtained a female baby of a product of non-consanguineous marriage, was born at 37 weeks of gestation, and they realized that the baby was having severe deformities and malformations in the skeletal framework and so on and so forth. So they conducted several scans. They conducted antenatal scan, postnatal echocardiography, ophthalmological examination, and finally they did karyotyping. And this showed an extra small marker chromosome. So basically we're reflecting the first slide we talked about, the extra genetic material on the chromosome number 22. So as a result of doing this karyotyping, they diagnosed that this baby is suffering from cat-eye syndrome. And these are my references I used for studying this research. That's it. Thank you for listening. Do you have any questions? Sure.
Thank you for your presentation, but I have a question. Is there any abnormal vision for the people has the cat-eye syndrome?
Yes, there is. Since there's firstly, the people who's living out of cat-eye syndrome, they don't live out long. As I mentioned in the first part, it's mostly during the pregnancy and as a newborn. So if they're going to live, I told you there's like deformities in the eye, the iris coloboma part. There's structures of the eye that's going to be missing, tissues from the eye. So as a result, your vision is also going to be accordingly affected.
Okay.
Yes.
For something as, well, I can't say little, but it doesn't sound like a grievous disease for people to be dying from it. So what is the relationship to other organs of the body where babies don't live past the 4th month and so on and so forth?
You see, this disease, the main thing is the iris coloboma, okay? It is just one part of, it's the main category, it's the most common symptom for everything. That's why it's called cat-eye syndrome. But other than the cat-eye syndrome, there is also like the other symptoms I've mentioned. There's like, I can show you even the case study. So you can, if you read this case study, look at how many defects there is. So there is pulmonary atresia, hypoplastic right ventricle, complex congenital heart disease, was shifted on the intravenous fluids and infusion prostaglandin. These are enzyme related, microcephaly, periovital puffiness, a long philotron. You see, I cannot list all these symptoms in the page.
One of many.
Yeah, one of many. There's also other common symptoms.
It's not the central one.
It's not the central one, yes. It's not the central one. Yeah. Any other questions, please?
So this equal between male and female,
Yeah.
right? What about the place? For example, the environment. Having more signal towers maybe affect your genetic. Is there any?
See, when it mentioned about environmental factors, as per the case research, it only mentioned about ultraviolet radiation. There's no other environmental factors that's mentioned related to the thing you mentioned about towers and anything. I don't think that has a direct impact. Yes. Any other questions? That's it.
Thanks.
Right? You have a question?
No, not a question. I initially thought it was going to be about the shape of the eye because cat-eye is now a fashion statement.
Really?
Where people do surgeries just to achieve the shape of it. So I thought that was what we were going to talk about, but this is good. I've never heard of it. Thank you.
This is born as a result of genetic. Though the people who do it, they do it for plastic. They do it for cosmetics. So yeah. Is that any other questions? Okay, thank you. Jazakallah khair.